When it comes to benefits for the elderly in the United States in 2025, the picture is both broad and marked by innovation, clearly reflecting the government's concern and efforts to protect the quality of life for millions of elderly citizens. To understand these changes clearly, let's review the important and specific updates that elderly people in the US have been entitled to since the beginning of 2025. One of the most notable highlights is the Social Security Administration, SSA, announcing a 2.5% increase in the cost of living for beneficiaries. This is not just a simple adjustment figure. It directly impacts the wallets and peace of mind of the elderly. With this increase, monthly living expense bills will rise by an average of more than $50, helping to alleviate some of the pressure from inflation and the rising costs of services, food and medicine. Increasing this allowance not only has financial significance, but also represents society's recognition of the persistent contributions of the previous generation. Elderly people, after many years of dedication, can now feel more secure financially as they enter a new year with many economic fluctuations. In addition, the year 2025 also marks an important adjustment by the U.S. Internal Revenue Service, IRS, regarding the standard tax deduction for taxpayers. This is a significant policy that helps protect part of the income of the elderly from being taxed, easing the financial burden that many retirees already face. Specifically, the standard tax deduction for single filers and married individuals filing separately is increased to $15,000. Married couples filing jointly will receive a deduction of up to $30,000, and the head of household deduction is $20,500. These deduction amounts are significantly higher than the previous year, providing substantial benefits to the majority of elderly people, especially those who still have income from pensions, investments, or part-time work. This change not only helps the elderly better cope with rising living costs, but also enables them to retain more of the money they earn or receive, thereby increasing their ability to pay for essential needs, such as healthcare, food, and housing. Especially with the rising costs of medicine, healthcare, and support services, every saved penny is significant for the elderly. Alongside the two prominent changes mentioned above, the social welfare system in the United States also continues to maintain and improve many important programs specifically for the elderly. For example, healthcare support programs like Medicare remain a solid foundation, helping older adults access medical services, medications, and healthcare at affordable costs. In 2025, Medicare may continue to expand its coverage, improve service quality, and prioritize support for chronic diseases and long-term care services. At the same time, Medicaid, a healthcare support program for low-income individuals, continues to play an important role for elderly people in more difficult circumstances. Many states are also considering increasing benefits or expanding eligibility criteria to ensure that the elderly are not left behind as medical costs rise. For elderly people who are still able to work or want to continue contributing to society, part-time employment programs, career orientation, or soft skills training are also maintained and upgraded. The government and many non-profit organizations have clearly recognized the value of keeping the elderly active, not only financially, but also for mental health and social connection. In addition to financial benefits and healthcare, elderly people in the United States also enjoy many other preferential policies, such as discounts on public transportation fares, free or reduced admission fees at national parks, museums, and cultural centres. Many states have special policies regarding property taxes, support housing costs, or provide free or low-cost community services specifically for the elderly. Another notable point in 2025 is the development of digital services and technology for the elderly. Thanks to technological advances, online medical applications, online health consultation services, online education programs, or virtual clubs for the elderly are becoming increasingly popular. This helps the elderly easily access information, connect with the community, learn and entertain themselves without being limited by geography or mobility. Overall, the latest benefits for the elderly in the United States in 2025 are a combination of increased social security benefits, reduced tax burdens, expanded healthcare services, community support, and access to technology. These changes reflect society's commitment to ensuring that the elderly not only live longer, but also live healthily, happily, and meaningfully. Elderly people in the United States, regardless of their circumstances, have the right to access support resources, be protected from economic and social fluctuation, and be respected as an important and indispensable part of the community. Every policy and new benefit announced is a step forward, helping to strengthen the elderly's confidence in the future and in the care and attention society provides for them. And looking back, the year 2025 is not only a year of increased benefits or tax deductions, but also a year of affirming value, honoring contributions, and protecting those who have dedicated their lives to building and developing the country. Elderly people in the United States can be proud to live in a society that continuously strives to make the years of old age meaningful, peaceful, and full of hope. Not only limited to financial and healthcare benefits, the year 2025 also marks an important transformation in how society perceives the role and value of the elderly. With the strong development of digital technology, many technology skills training programs specifically for the elderly have been implemented nationwide. Free classes on how to use smartphones, tablets, online medical applications, and social networks help the elderly easily access information, connect with family and friends, and participate in community activities. This not only bridges the generational gap in technology use, but also helps reduce feelings of loneliness, enhance mental health, and boost confidence among the elderly. Alongside this, social organizations, elderly associations, and local authorities have also intensified physical and mental health care activities through health clubs, yoga, dance, arts, and cultural programs. These programs not only provide opportunities for the elderly to exercise, but also open chances for social interaction, sharing life experiences, community bonding, and fostering optimism and a love of life. Particularly, volunteer activities, psychological counseling, and free legal support for the elderly have been increasingly expanded, helping them proactively resolve personal issues, protect their legal rights, and participate in building a civilized and compassionate society. Regarding housing, the government and non-profit organizations have collaborated to implement many projects to build and renovate housing specifically for the elderly with preferential prices, suitable designs, and full amenities. Residential areas for the elderly integrate medical services, nutritional care, security, and recreational activities, creating a safe, convenient, and friendly living environment. Additionally, policies supporting rental assistance, home repairs, and infrastructure upgrades are widely applied, helping the elderly live independently, safely, and comfortably in their own homes. In transportation, Discounted fares for the elderly on bus systems, subways, trains, and airplanes continue to be maintained and expanded. Many localities have also established specialized bus routes convenient for traveling to hospitals, community centers, and entertainment areas. Public transportation is equipped with support systems for people with disabilities and the elderly, such as elevators, priority seating, clear signage, and attentive staff, ensuring safety and convenience in travel. In healthcare, besides maintaining and expanding Medicare and Medicaid programs, 2025 focuses on developing preventive medical services, free regular health checkups, vaccination, nutritional counseling, and support for treating common chronic diseases among the elderly, such as cardiovascular diseases, diabetes, and musculoskeletal disorders. Hospitals and clinics have also strengthened training for geriatric specialists and nurses, invested in modern equipment, and improved home care service quality to better meet the diverse needs of the elderly. Especially, the creation of an elderly-friendly living environment is promoted at all levels, from urban planning, park design, walkways, public restrooms, to community education programs on awareness of respect, protection, and support for the elderly. These changes not only help the elderly move easily and actively participate in social activities, but also create conditions for them to continue contributing their intellect and experience to the country's overall development. A notable highlight in 2025 is the development of multi-generational community models, where the elderly live and interact with other age groups, such as children, teenagers, and adults. These projects provide opportunities for bonding and sharing, helping younger generations learn life experiences and cultural traditions, while the elderly feel cared for, loved, and valued within the community. Cultural exchanges, festivals, seminars, and intergenerational dialogues are regularly organized, contributing to building a united, civilized, and sustainably developing society. Alongside state support policies, the cooperation of businesses and social organizations in designing products and services suitable for the elderly also plays an important role. From healthcare products, nutritional foods, mobility aids, to financial services, insurance, and entertainment, there is a focus on improving quality, safety, and convenience to meet the increasingly high demands of this group. All these outstanding changes in 2025 have created a significant leap forward in improving the material and spiritual life of the elderly in the United States. This is not only the result of continuous efforts from the government, social organizations, and businesses, but also an expression of gratitude, respect, and commitment to protecting the preceding generation. With prioritized policies, thoughtful care, and a favorable living environment, the elderly will continue to play their role, contribute to community development, and enjoy a healthier, happier, and more meaningful life than ever before.